to mental health as well, which is reducing stigma around mental health and increasing emphasis on prevention and awareness, and work around child mental health as well. And also shifting focuses away from infectious disease and more towards non-infectious and chronic disease management as well. That's it. Thank you for listening.
Did we spell it right? Is that right?
Yeah.
Yeah? Okay, cool. Are there any questions?
Congratulations for completing your placement. I think that this presentation is very great. You have collected a lot of data, and then you have been to many places in previous, but I think you have had a good opportunity to visit many levels of healthcare system in Vietnam, from the provincial level to the communal level, and you really grasp a lot of important and key information relating to the health system and the health issue in Vietnam. And interestingly, you have a critical idea for cooperation between the two countries. And I really highly appreciate what you have done. And thank you very much for this presentation. And now I think we should have some discussion regarding this issue. And anybody have any question, please raise your hands.
I have one question for Lara. And what do you think about young people, culture of young people in Vietnam and Australia? It's different because I think you have a some idea about this topic. Can you share?
The culture is very different. I think because of our economy, I don't know, that Vietnam looks up to places like the US and Australia economically, but with money comes silly decisions and reckless behaviour. A lot of our problems with young people is because we've got too much money. They do silly things and endanger their health and don't think about the consequences because somebody else will pay for it. Be it mummy and daddy or the government will pay for it or Medicare will cover it. And I think young people here are much more responsible and don't take as many risks. They're a lot more respectful than young people back home.
Any other questions or points of interest? high school that I went to back in Australia, we had 2 kids with Down syndrome, and we also had 1 girl in a wheelchair. So really just working to integration and minimising stigma. It's really, like, I never really thought about it before, but it's really good.
And do you get any difficulty here in Vietnam? Do you have any difficulty?
Difficulty.
Yeah.
The drinking water. You can't drink the tap water. It's different. I drank the tap water and was very sick.
Oh, so in Australia you can drink directly from the tap water, but here you can.
Yeah, it's just a little bit different.
That's just whenever you travel though. It doesn't, it's not used to the.
You need.
So you have to buy.
Yeah.
And
I think I go for about 2 of these a day.
Any other difficulty?
It's very hot here.
Oh,
It's very hot.
I mean this side is not very hot.
It's in Australia. It does get very hot. It's just a very different heat.
Not here.
It's not as muggy or humid. It's a drier heat, so you can go about your daily business and not sweat. Yeah, it's been really interesting.
I've had difficulties with allergies. Allergies. I'm allergic to chemicals. Certain chemicals I'm allergic to, and there's no panel on the back of foods to say what is included, additives or preservatives. So that's been interesting.
I have a lot of hay fever back home, but ever since being here I haven't had to take any of my medication for my nose. So I'm not sure, maybe I'm just allergic to Australia. It is. But no, I really loved it here. Thoroughly enjoyed it. Everyone's made us feel so welcome, and I really want to bring my family back here. I think I love it. So yeah.
And you're a student, you have to pay for monthly
Pay
insurance
insurance, have to pay health insurance monthly.
every month.
But yeah, we pay $90 to $100 a month.
So $2 million.
Every month.
$2 million a month. Yeah.
You have to pay your own.
No, we choose to get, because the public systems, it's alright.
The government encourages you to
Yeah.
take it out because then it alleviates the poorer people and they get more of the free stuff, and the rich people, they encourage.
There's a system where, because my husband earns so much, we get big taxes
Yeah.
if you don't have health insurance. So then we get a big payment at the end of the year because we did the right thing. So,
And it just alleviates the stress on the public system, which should be utilised for people who don't have access to the healthcare services that we are fortunate enough to be able to afford.
So I would like to ask you one question. In Australia, you have an urban area, you have a rural area, and do you have a semi-urban?
We do. It's
all sort of very
majority of the population live on the coastlines. So we have our main city areas, and then you can go into mid-urban areas which are still on the coastline, but they're not a part of the big cities. So they're still, where I'm from, I'm about an hour's drive from Brisbane, but it's still got all of the facilities that you would find in Brisbane. It's just maybe not, there's just not as much of it.
It's just as soon as you go inland,
Yeah.
in any direction, there's less. Yeah.
Yeah, I think.
Here in your presentation, in Ludwig district, Ludwig, the call is urban. Do you agree with that? Ludwig, there is a Ludwig. Urban.
But that makes sense. So yeah, a bit different.
And can you tell us a little bit about the cancer prevention program that you attend?
Okay, so that was on Thursday morning last week, and
At school?
we attended the presentation, and we were told that they were talking a lot about cancer prevention and the importance of screening and living a healthy lifestyle, so not smoking, eating good food, and being active. Then we were meant to participate in a march down the main street, which was to end at the bridge, but because it was at the end of the cyclone or the typhoon, it was cancelled.